Hi, this is Mac Thornberry. I'm in my office in Washington on Tuesday night, and I'm about to walk over to the Capitol in a few minutes to hear the President's annual State of the Union address. Of course, this is required under the Constitution that the President come before the Congress and report on the State of the Union from time to time. There's been a real effort this year, though, to not just have the speech be before members of Congress, but to invite people from our different districts to focus on various issues that are foremost in the minds of the American people. And this year, I've invited Dr. Dick McKay from Amarillo, Texas, to come and be my guest at the State of the Union. Dick is a very knowledgeable physician who has been involved in a lot of public policy issues for the Texas Medical Association and others. And he's here partly because of the importance of health care as a national issue, but also in each of our own lives. And so, Dick, thank you very much for taking time to come. I hope that at least you enjoy the experience tonight with the President's speech.
Well, I thank you for inviting me. As you know, I've been coming to Washington for a lot of years with the American Academy of Orthopedic Surgeons and with the AMA. Because I think it's important that doctors get involved in the political process, and I feel fortunate to have what I consider the most informed congressman in healthcare issues who's not a doctor, being my congressman. I'm an orthopedic surgeon. I've just recently retired in July of last year. Practiced 38 years in Amarillo. I did a lot of Medicare work because my practice got old with me. And so I did a lot of total hips and total knees, and probably 65% of my patients were Medicare patients. And it was some of the hassles that began to creep up into Medicare over the last few years that kind of helped push me over the edge into retirement. You know, I do hear from my friends. The doctors in Amarillo all know that I've been involved, and they fortunately are appreciative of that. Most of them don't want to do this. But I hear from them on what's going on now with the rollout of the Obamacare. The other issue we've talked about in the past is the ICD-10, which is the coding system, which is so messed up that the first time I heard about it, I said, the day that goes into effect is when I'm going to retire. Now, the AMA was successful in delaying that for a year, and I decided not to wait on ICD-10s. Every time I hear anything about Obamacare, I think I decided to retire at the right time. Great. Well, I still remember at one point, it may have been 10 years ago, when Mac and I were talking about Medicare, and when the fee schedule started going down, and I said, well, you know, they don't pay very well, but there are no hassles. Well, that's how long ago? There are now hassles. And they're paying less and more hassles, and that was kind of the cross that came across that pushed me over the side to retirement.
I'm very grateful that not only Dick would come, but would be involved in these sorts of things. You know, it is true that most physicians are focused on taking care of their patients, and they don't really want to be involved in some of these public policy disputes. And yet, if we don't have physicians involved, then we won't have that input that you just absolutely have to sort through these complex issues. So I appreciate very much Dick being here.